Welcome to this new module, Medical Emergencies. It will cover all types of medical emergencies. After completing this module, you should be able to define terms related to medical emergencies, explain the purpose of an emergency cart and its contents, describe the signs and symptoms and procedures for handling various medical emergencies, and finally, demonstrate appropriate principles of cardiopulmonary resuscitation. We will now review the CPR section. It includes CPR guidelines, one-person rescue, two-person rescue, and children and infants. The function of CPR is to provide external support for circulation and respiration. CPR consists of three primary aspects: airway, breathing, and circulation. Cerebral functions are impaired if the brain is deprived of oxygen for over 4 to 6 minutes. It is therefore essential to keep an uninterrupted oxygen flow to the brain. CPR is not indicated in all situations. For example, if the patient has a DNR or do not resuscitate order, do not begin CPR. Always make sure the patient has true cardiopulmonary distress before beginning CPR. However, if in doubt, CPR should be initiated. Once started, CPR must be continued until the victim resumes spontaneous respiration or circulation, a physician or other healthcare professional calls a halt, or the rescuer is too exhausted to continue. Do not interrupt CPR for more than 10 seconds. Improper CPR can cause injuries such as sternal fractures, pneumothorax, rib fractures, lacerated liver or spleen, or a fat emboli. CPR should only be performed by a trained professional. The AED should be put in place as soon as it is available, and both pads must remain on the patient throughout the CPR. The automatic external defibrillator will reanalyze the patient every 2 minutes and apply a shock if needed. It is important to perform CPR correctly. The 30 compressions should be completed in 18 seconds or less. Breathing should be checked for 5 to 10 seconds, and a patient gasping is not considered breathing. The Bee Gees song, "Stayin' Alive," has a rhythm of 103 beats and was endorsed by the American Health Association, or AHA, as the official song to use when maintaining the 100 compressions per 60 seconds that should be delivered during CPR. If there is a suspected foreign body, the rule for infants, child, and adults are different. For infants, 5 back slaps and 5 chest thrusts are first performed. These are repeated until the object is expelled. If the patient becomes unresponsive, do CPR, and do not do a blind finger sweep. For children ages 1 to 8, use the abdominal thrusts until the object is expelled. If the patient becomes unresponsive, do CPR. Do not do a blind finger sweep. And for adults, use abdominal thrusts until the object is expelled. If the patient becomes unresponsive, do CPR with a finger sweep if the object can be seen. The acronym for a one-person rescue is CAB, or capital C-A-B, meaning compression, airway, breathing. The first task is to secure the area. Next, establish unresponsiveness by shaking or shouting at the victim. If no response, call for help and the AED. Ensure the patient is on a firm surface and the area is secure before beginning CPR. First, check breathing for 5 seconds, but no more than 10 seconds. Check by watching the rise and fall of the chest, or place a hand over the mouth or nose to check for breathing. If there is no breathing, proceed to CPR using the chest compressions. The force of compression should be sufficient to depress the sternum 2 inches in an adult. If 2 people are available to perform CPR, the rescuers can alternate. One applies compression while the other ventilates. The rates should be 30 compressions to 2 ventilations, followed by a 2 to 3 second pause. The compression rate should always be 100 compressions per minute. When performing rescue on infants and children, there are slight variations. In infant rescue, use less air and use 1 to 2 fingers only, placed on the sternum, just at level with the intramammary line. The sternum should be compressed to a depth of 1.5 inches. The compression rate remains the same at 100 compressions per minute. In children 8 years and under, use 1 hand only for compression. The depth and rate of compression remains the same as for an adult. Compress to a depth of 2 inches or 5 centimeters with 100 compressions per minute. This is a summary of the CPR guidelines by age. The guidelines list the breaths, rate of compression, method of pulse check, depth of compression, placement of the hands when performing compression, and the compression to ventilation rate for 1-person and 2-person rescue.
Thanks for watching. To purchase the full course and earn your CE credits, click on the link in the description or head on over to our website at www.medical-professionals.com. And while you're there, check out our All Access Pass, where you can get unlimited CE credits for your state and ARRT renewal for just $49.99. We also offer a host of free resources to make it easier than ever for radiologic technologists like you to achieve excellence. Check out our free radiology CE webinars, clinical reference guides, and free CE courses on our website today. Be more than just certified. Choose medical professionals.